Welcome to the East Ohio Conference HealthFlex workshop for the 2020 benefit plans. This is our 2019 workshop for participants. Most of the materials that you will be going through with this workshop are going to be listed on the conference website, but are provided to those in attendance in the packet. Our agenda this afternoon primarily is the HealthFlex Exchange overview, plan choices, the premium credit, the health accounts known as HRA, HSAs, FSAs. The ALEX decision tool, along with the plan selection that you will go through at annual election, which is October 30th through the 14th of November. These various terms that you see on this slide are the terms that we typically use throughout the industry in discussing our healthcare coverage. Co-insurance, which is the percentage of the health expense paid by the participants, so that's your nickel. The co-payment might be a fixed amount that is paid by the individual. A premium credit, or credit known on this slide, is the amount that the plan sponsor is going to provide for you to choose your plan. Deductibles, that is your nickel, and part of the first part of your plan in choosing any of the elections. FSA, which are flexible spending accounts. There are two types, a health account and along with a dependent care. A new term for us in East Ohio is an HMO. This is a health maintenance organization. We'll talk about that in length later. The health reimbursement account, the HRA, and along with the health savings account. Out-of-pocket maximums, that's the maximum you pay under the plan if you incur the costs. PPO is a preferred provider organization, and the premium is the monthly cost. We're going to go right into a video here and as an opening to the exchange.
HealthFlex Exchange. Health insurance provides a safety net to limit how much you have to pay if you or a family member is injured or becomes ill. It also helps finance the care needed to maintain good health. 6 options are available, so you can choose the value and peace of mind that best fit your needs. HealthFlex Exchange is a group health plan designed for United Methodist Church clergy, affiliated lay employees, and their families. This approach to choosing health coverage gives you choice, flexibility, and control over how you pay for health care, while helping the church facilitate health coverage for clergy and lay workers. HealthFlex Exchange offers a high-quality network of doctors, hospitals, pharmacies, and other providers. You will also be able to choose from multiple dental and vision benefit options. You will have access to a comprehensive, award-winning well-being program that includes incentive opportunities. There are health screenings, an activity program, numerous support tools, and so much more that can help you take the healthiest path through life. These are key to the HealthFlex commitment to well-being. HealthFlex Exchange puts you in control of your plan selection. With our online support tools, view side-by-side plan comparisons so you can choose the plan that you think best suits your family needs and financial risk tolerance in the case of emergencies. Welcome to HealthFlex Exchange.
Now, there are 2 major differences between the HealthFlex Exchange and the previous plans that we have sponsored in the East Ohio Conference. In the past, we had a one plan, and this is going back to 2017, but as we moved into 2018 and 2019, we moved into some further options partnering with HealthFlex. With the HealthFlex Exchange, you have 6 medical, pharmaceutical, and behavior plans, 3 dental plans, and 3 vision options. Some plans will cost more each month, and you will owe less, whereas when you use services, whereas some will cost less each month, but you will owe more when you use services. In addition, you will be given a fixed dollar amount known as a premium credit that is used toward the purchase of your plans. The same premium credit no matter which plan you choose. So if you choose a more expensive plan, you're going to pay a buy-up cost, which is a deduction from your compensation. You can see at the bottom of this slide here, if you elect a plan that costs more, your credit, this is your credit, you will pay an extra, with your credit, you will pay an extra premium, which is the buy-up. through a payroll deduction if you elect a plan that costs less than the premium credit. And the excess additional premium credit will be deposited in your health reimbursement account or the HSA account, which is the health savings, depending on the plan you choose. Various things remain the same as to what you know about the HealthFlex exchange today. They are the same regardless of what plan you choose. It is a high quality and commitment of service that we hope that you can count on from WestPath. Now, WestPath is our partners for benefits, WestPath Benefits and Investments. They hold our pensions along with our health care through HealthFlex. They are the same medical and behavioral health providers and networks that we've had today, the same pharmaceutical benefit providers and formularies, and the same well-being programs and incentives. HealthFlex continues to provide more plans to choose from, more flexibility to allow you to align your plan with financial and medical needs, more support for you to make choice. We can't ask you to be responsible for making a big decision without giving you some supportive aids.
You will have 6 HealthFlex medical plans to choose from. 3 of the options are referred to as HSA plans. They are paired with a health savings account. 2 plans are referred to as HRA plans. They are paired with health reimbursement accounts. There is also a traditional plan, the B1000, which in most cases does not include either type of account. Both types of accounts cover medical expenses with allocated money on which you don't pay taxes. There are differences in how each plan works. All HealthFlex plans cover eligible well-person services in full with no out-of-pocket cost to you, including annual checkups and age-appropriate immunizations and screenings. But there are important differences in how these plans cover other services, like doctor visits, hospital care, and prescriptions. With the HSA plans, you will have to pay the full discounted cost for all services, including pharmacy, until you have paid your deductible. If you have covered dependents in one of the HSA plans, the deductible will be the family deductible, even if only one person has expenses. And with the HRA plans, you pay the full discounted cost of medical services only until you have paid your deductible. Then the plan starts paying a percentage. For pharmacy and behavioral health expenses, the plan will pay for part, even if you haven't met the deductible. And with the traditional B1000, you will pay a fixed co-payment for some services like office visits, emergency care, and medications. But for other services, you will have to pay the full cost until you have paid the deductible. Each HealthFlex medical plan includes medical, prescriptions, and behavioral health coverage. Each plan offered is available to every participant, and overall, none are better or worse than the others. There are just options. You choose the plan that best suits your health and financial needs and how high you'd like your safety net to be. Some have lower premiums and higher out-of-pocket costs. Others have higher premiums and lower out-of-pocket costs. The choice is yours.
Let's take a moment to orientate ourselves to the plans and some of the images you'll see. Note the plans' names are on the apples. Each leaf of the apple tells you the kind of health account that may come with the plan. The green leaves are for the HSA plans. These come with the health savings account. We'll talk about more about that later on. The blue leaves are the HRA accounts. These are the health reimbursement accounts. The orange leaf means the B1000, and it does not come with a health account. You'll also notice the apples are different colors. The gold color apple has the highest cost in premium each month and also means that you will pay less when you need to see the doctor or get medication. The silver and bronze colored apples cost less premium each month. That means you will pay more when you need to see the doctor or get medication. There is no good plan or best plan. They are all plans that will protect you if you have catastrophic expenses, but they work differently. And now we're going to talk about more of how they work. As you heard in the video, health insurance is a safety net. It's designed primarily to protect you in case of health crisis. All the plans protect you from a very high catastrophic expenses. Those with a higher monthly premium, the white bar, mean you will have a closer net. Your share of bills, the yellow bar, will be less if you need to use health services. Those with a lower monthly, over here to the right, monthly premium still have the safety net, but it's a bit lower. This means you initially pay a higher share of your bills when you use healthcare services, but it will still protect you from maximum out-of-pocket exposures. Let's do a quick review of how the plans work. For most expenses like hospital stays, you have a deductible, which means you pay 100% of the discounted cost for the service. You can also use your health account to pay for those services, but they are ultimately your responsibility. Once you meet the deductible, HealthFlex starts to pay for the part of the discounted cost, which is known as the co-insurance. You pay your co-insurance share for all the remaining services until you hit the maximum out-of-pocket. Once you have paid the maximum out-of-pocket, HealthFlex begins paying 100% of the cost for eligible services, doctor visits, hospital surgeries, medications. As long as they are eligible expenses, you don't have to pay any more once your maximum out-of-pocket is incurred. Co-payments, which pretty much are on your B1000 for services, work a little different and may apply before or after the deductible has been met. If you have met your out-of-pocket maximum, you won't owe a co-payment either. So no matter which plan you choose, you should know that all of your wellness care is covered at 100%. If you are just seeing a doctor once a year for your doctor visit, for your annual physical, you won't pay no matter what plan you pick. The maximum out-of-pocket, that protects you from the catastrophic expenses. Note the cap does not include dental or vision expenses. Medication and benefit applies to the discounted amount, not the original bill amount. A deductible that applies for most hospital and outpatient services. The same provider networks and formularies are there for you. They give you discounts on services and expenses. Now, most of this graphic is in your How to Choose brochure. The green boxes are for HSA plans. These come with health savings accounts. So on the far left are your green plans. Those are your H plans that come with an HSA, a health savings account. The blue boxes are HRA plans. They come with a health reimbursement account. The orange box on the far right does not have a health account. Now let's go across to the very top. The very top row is the names of the plans. The plans on the left of each set of the plans have the highest deductible. So if you're looking here at the green columns, those are your H plans. And on the left side is your more expensive, which is the H1500. If you go over to your blue columns, to the HRA plans, the one on the left, the C2000, is more expensive. And then the B1000 is your most expensive plan. And these will all require additional buy-up premiums from deductions from your compensation. The next row is the health account funding. And you can see it is at the very top. So on the H1500, you get a HSA account for $750 for a single person. If you're a family of 2 or more, you'll be given $1,500. The same applies on the HSA account for the H2000. $500 for a single person, $1,000 for more than one person. Whereas you can see in the H3000, there is no funding for a health account. Again, looking at your HRA plans, the C2000 comes with a health reimbursement account, $1,000, $2,000, depending on the members. The C3000 comes with a smaller account, $250 and $500. Again, the $1,000 does not come with any health account. At the beginning of the year, This money is then available to you to pay the expenses, deductible, co-pays, co-insurance. On this slide, find the row that shows the deductible, and that would be further down, and look for your deductible, and that is right underneath underneath the health account dollars. And you can see where the H1500 has a $1,500 per person with a maximum of $3,000. The identity of each of the plans basically is based on the deductible. So it's a key to understanding what benefit you choose, whether it's an H1500, $1,500 deductible, H2000, $2,000 deductible, H3000, $3,000 deductible on a crossed. Whereas on your far right, the B1000 has a $1,000 deductible, but this is a very rich plan. We as a conference have never been able to afford this type of plan, primarily because it has very much a plan design with a lot of co-pays for your office visits that are outside of your deductible. We as a conference have always had everything subject to a deductible, even in the days when we had $200 as our deductible. Note that the white box in this section of the HSA plans. So underneath those deductibles, you'll see if greater than one person is covered, the deductible always applies. The family deductible always applies. So if you're a family of 4 and only one person becomes ill, that one person will be required to meet the full family deductible before those claims are starting to process using a copay or coinsurance. Whereas your C plans, they act differently. Your C plans in the blue, they act differently. One person has their single deductible. They do not have to meet the family deductible. Big difference between your H's and your C's. In the HSA plans, like I said, if you have more than one person, you have to meet the deductible, even if only one person has the expenses. And this is due to the IRS requiring family deductible be a certain level to qualify for contributions for a family amount to an HSA account. Now find the row that highlights the out-of-pocket maximum. That's about the 4th list down. You can see what's important here is to understand your out-of-pocket if you choose a plan. You have to accept that liability if catastrophe hits you in a given year, and typically it would take a hospital stay. So understanding the differences of the plan, where the H1500 is a $6,000 out-of-pocket if catastrophe happens, whereas the H2000 is a $6,500. The H3000 is $6,500, and so on across the screen in the C2000, C3000, and again the B1000, which is a richer plan, is $5,000 per person. Now it's important to note that if you are on prescriptions, that on the H plans, all prescriptions must go towards your deductible, and that is the full cost of the prescription. So if you're used to on a C plan or a B plan that you are paying just a outright co-insurance or co-payment at the pharmacy for your name brand that might cost $35, and then you decided, well, I'm going to expose myself over here to the H plan, have a full understanding of the cost of that name brand drug that you're taking. It is not going to be $35. It may be $1,200. One of the best ways to do if you have various drugs that you or a family member are taking is to understand the cost of drugs. Because in a co-payment that you pay at the pharmacy, the plan is picking up the difference. So knowing if you're choosing an H plan, and if you don't know what your full cost of that prescription is, you could check with your pharmacy. You could also Google that. You can do a search as far as what is the cost if I buy it outright. So just make sure you are well aware of the various nuances of the plans and accepting that. Now truly, if you're on a prescription and you're on the H plan and you get 3 fills, you're going to meet that deductible real quick if you have a high cost of that prescription. Once you meet those deductibles, then you're going to go into the copay for prescriptions. Now this here is a presentation of the plan's similarities and differences. Pretty much you can see what they have to say in the doctor's urgent care on a copayment fixture. On the B1000 is a fixed amount. We do not have that in the H or HSA plans or the HRA plans. Pretty much with regard to the coinsurance after deductibles met, you can see that with the HSA plans, HRA plans. Prescriptions, you're going to go straight to the copay on the HR plans and the B1000, whereas, like I said before, prescriptions are subject to the deductible under the H plan. Mental health, this here is, again, you can pay on the B1000, you're just going to pay a copayment. Now, mental health is covered under all these plans, but it does not, it would either hit your deductible, but you're not going to pay a copay unless you're choosing the H1000. Now, this is the same information, but it's presented in a different way. Westpath had asked 10 people how would they see the presentation of the information, and half said one way and half said the other way, so they present both of it. So pretty much it's the same information, but presented in a different way. You can look at this more online and certainly in your handouts that you have for today's event. Preventative medication and HSA plans. Now, preventative medications are being talked about quite a bit, and OptumRx has defined a list of preventative medications based on the guidance of some preventative services entities. The list includes drugs in various categories that you see on this slide, and for a full list you could go to their website and access that information. This will be outside of the deductibles on all plans on these preventative medications. Now you have a separate handout in your packet today, and that was your premiums. It is on the same format I've given you for the last 2 years. And what I want to draw your attention to is the bottom of that page of the premium chart. The bottom of the premium chart, you have a darker green in between the 3 columns of green. The H2000 is the given plan for the East Ohio Conference. So that is the plan that is given to everyone, and this is the cost. If you move up the plan, up the handout that you have, you can see the conference premiums are a little different. Well, not a little different, only the clergy rate is different. But you can see that this year for 2020, we are billing the actual amount, especially on the lay side for local church. Clergy group is a little different because we take all of them, put them all together, whether they're participant plus one, or participant plus family, and we look at what is the cost for that clergy group and area center staffing. And then because that group is heavy on the participant plus one and participant plus family, that premium is a bit higher. And you can see from your handout, the flat rate is $15.12 a month. Now what you're going to see here is when you go into your WebMD portal to elect your plan, if you're a single person, you're going to get $765 because that is participant, even though your budget or your budget owner may be billed the full clergy flat rate of $15.12. But if you're a participant only, you get the $756 to spend on your plans. Now if you go across on this screen, you can see all the different costs. They're also recorded for you at the bottom of this handout that I gave you. And basically, in any buy-up or premium credit function, it is the difference between the H2000 plan and the plan that you elect. So on the handout that I gave you, if you go to the middle of the page, again, you'll see the darker green, and you can see it doesn't cost you anything, right? But if you go to the right or the left, you may either have a buy-up premium or a premium credit. And that is all presented to you on this handout as far as what the actual costs of these plans are. The cost primarily on the premium credit and the buy-up cost is the difference in the cost of the plan, which is listed at the very bottom. It's just a worksheet to help you understand the costs, but they're pretty much out there on this slide. There are a lot of things to consider in choosing your plan. Later we'll be introducing again Alex to you to help make you make your decision making. But things that you have to consider: how many people am I covering? How much service do we plan on using? How comfortable I am with large expenses? And how close am I to Medicare? Other factors in choosing a plan is your financial risk tolerance. Not everyone will choose a plan that costs them a net lower cost when considering the premium and out-of-pocket, but you are to consider how comfortable you are. Do you have the savings that may help offset large costs, or a health account that may help you fund those costs? We strongly encourage a plan that has a health account if you're choosing a lower cost plan. Now, considering a lower premium plan, in this example that you can see on the screen, if you have a $1,500 out-of-pocket and you're in a B1000 and you're considering buying down to a lower HSA plan ahead with your HSA. If the difference in your premium is like $260 a month between the B1000 and the H2000, that's a cost of $3,100 for the year. The logical thing to do is to contribute that to an HSA instead of paying the premium. And that the money belongs to you when you need it, because you just paid a premium, whereas if you did the HSA monies, deduction from compensation, so basically you exchanged how you paid it. You paid it to yourself on an HSA, and that money can roll over from a year to year and actually go with you into retirement. In the other example that they provided on a $400 a month difference between the B1000 and the H3000, we're talking $5,200 a year. Consider the fact that, yeah, you know you were going to pay $1,500 out of pocket, but why pay $5,200 to get the $1,500 out-of-pocket plan? You can own the money, and it goes with you. HRA plans and HSA are growing in popularity, and throughout this presentation you're going to hear a significant amount of encouragement for the HSA plans. They're here to stay. They have been out there in the industry for employers for a very long time. So pretty much right now, as HealthFlex is advising us, over 2/3 of those who are participating are enrolled in the HRA HSA plans. And this is certainly to avoid buying more insurance. It controls your health care dollars and saves money for current expenses and prepare for future. Now we'll talk about the dental and vision considerations. Again, whenever you choose plans, when you do open election, you want to consider who is the covered individuals, whether you need dental and vision use, and the financial risk. We have dental plan choices with Cigna. Now that is not with Blue Cross Blue Shield. People got confused instead of giving their dentist the Blue Cross Blue Shield card, and they were told they had no coverage. Well, you don't have coverage through Blue Cross Blue Shield. You have it with Cigna. There are 3 different plans through Cigna, and one is a new one for this year. The PPO and the passive PPO uses Cigna's PPO Advantage Network. The passive PPO means you have the same level of benefit whether your dentist is in network or not. You get the advantage of discounts if your dentist is in network. The PPO plan has more generous benefits if you go in network. For these 2 plans, the PPO and the passive PPO dental plans, you don't have an out-of-pocket maximum. Instead, you have a benefit maximum, meaning the plan will only pay up to a certain dollar amount in a given year. So if you got 3 caps that you have to have, they're only going to pay out a maximum per the plan, and you need to know what that is. Is it $2,000? Is it $1,000? You need to understand it's a maximum of what the plan would pay on these on your Cigna dental plans. Both plans, if you get preventive checkups, you can increase your maximum benefit by $150 up to 3 years in a row. This has been a provision under the plan since we started with them in 2018. You can actually increase your maximum benefit up to $450 just by getting your teeth cleaned routinely under the plan, which is a covered expense. The new option that they are presenting this year is a dental HMO. Now, HMO is a health maintenance organization. It is very different. We've never partnered with an HMO in East Ohio, but it is a health maintenance organization. Now, it is going to be a lot lower cost, but has a narrower network and is not available in all zip codes. Still, if you're willing to stay in the plan's network, you pay co-payments for charged schedules for something on the schedule. Other differences is access to adult orthodontia if you choose a primary care dentist. Only the HMO has a physical ID card. You have to select a primary care dentist, and the dentist's name would be printed on your card. If you have multiple dentists in your family unit, then you can designate primary dentist for the children versus the adults, as long as they are in the HMO. Now, this will not fit everybody. Like I said, it is not available in all zip codes. You need to do your research. Now, also on the HMOs, you either go in a network and use them, because if you go out of the network, the bill is all yours to pay. These are the various choices. This is also in the other handout that we gave you for today. You can find this more detailed in, let's see, pages 8 of the larger handout. And this is just a comparison of the various pieces that may be important to you as far as the deductible, how the preventative diagnostic pays, how the plan pays for restoration, major restoration, and orthodontia. These are your dental premiums for East Ohio. They're also on the individual sheet that we gave you. They may be presented a little different than this slide, but they are your nickel to pay. This is not picked up by your plan sponsor, which is your employer. These are all buy-up costs. Vision choices. Basically, again, we have 3 vision plans. An exam-only plan, which is they call it an exam core, and details of that can be found on page 9 of the handout we gave you. And pretty much the full service, that exam is provided along with about $160 towards glasses and contacts. Your Premier plan, you get exam plus $200 towards glasses or contacts. And there are some differences with regard to how often you can get your glasses and contacts. The Premier is generous in the fact that you can get frames every year. So now the exam core, the first level, that is provided to you at no cost. It's just by enrolling in a medical plan, you get that one. So if you're not into contacts or glasses, not heavy into that, the core exam might be the easiest one, or the plan that is provided, and you're happy with that. Now, the vision plans are all through VSP, and there are no identification cards, but you can print one from your WestPath WebMD portal, or contact the health team at WestPath for assistance. Now, the premiums for the vision plans are presented on this slide. You can see here the exam core. There is no cost to that. It comes automatically with your medical plan. If you choose any of the full service or Premier, that's an additional cost to you, deduction from your compensation.
Although you will choose your HealthFlex plan, your employer helps you pay for it. Your annual conference or other UMC employer designates a premium credit to be used specifically to purchase your HealthFlex plan. Your premium credit is an annual fixed dollar amount that you receive to apply toward the monthly cost of HealthFlex plan premiums. The credit will appear when you're selecting a health plan online during annual election or when you first enroll in HealthFlex. It will reduce the total premium to the actual amount you owe, and it is applied to premiums for your medical plan, as well as any dental or vision plan you may select. To understand how the premium credit works, let's compare two pastors in the same annual conference. In this example, the premium credit is $700 per month, or $8,400 per year. Both pastors receive the same premium credit amount. Through HealthFlex Exchange, Pastor John selects a plan that costs $800 per month. Because Pastor John's premium costs more than the $700 monthly premium credit amount, he is responsible for paying the difference. His church will deduct the extra $100 each month from Pastor John's paycheck for his health plan premiums. Pastor Judy, however, selects a plan that costs $600 per month, which is less than the $700 monthly premium credit amount. In this case, the $100 difference between the monthly premium, $600, and the monthly premium credit, $700, will be credited each month to Pastor Judy's health reimbursement account or health savings account, depending on which plan she selects. Pastor Judy can use the funds for her deductible, co-pays, or other eligible health care expenses, or she can save the money in her account for future health care expenses.
So what is the premium credit? It's a new approach to the cost sharing of a plan. It is a fixed dollar amount, and I had mentioned earlier, your fixed dollar amount is your H2000 participant, participant plus one, or participant plus family. That's found at the bottom of the page of the handout. This was an amount that you will use to shop for your HealthFlex plan. The premium credit will be shown on your portal when you go into it for open election. It will be pre-populated based on your choice. So if you go in and you elect participant only, it will pre-populate with the participant only premium for the H2000. And then you will go about electing your plans. As we said here, with regard to a Pastor John and Pastor Judy, the credit will help you pay for your plan of choice. So Pastor John, he gets the same amount of $700 as Judy does. In this slide, Pastor John elects a plan that's a little bit more costly, $800 a month. It is then his nickel to pay as a deduction from compensation, the difference between the given plan and his buy-up plan. And in this sense here, for Pastor Judy, Judy elects a plan that is a little less costly at $600. So then the extra $100 will be deposited into her HRA or HSA as an additional premium credit, and it goes into the account on a monthly basis. You can use this also to buy your vision and dental benefits on the additional premium credits.
Most plans available through HealthFlex Exchange include a health savings account or health reimbursement account. These accounts allow you to pay for out-of-pocket medical expenses with money that isn't taxed. Make sure you consider the value of these health accounts when making your medical plan choice. Let's look at HSAs and HRAs more closely. Both types of accounts allow pre-tax funding contributed by your plan sponsor. Both are intended for eligible health care expenses. Both allow balances to roll over and build year after year, with no limit on the amount that accrues while you're in HealthFlex. And both accounts are compatible with an optional dependent care flexible spending account, which you can elect during annual election. 3 of the HealthFlex plan choices include an HSA, and 2 plans include an HRA. The HealthFlex HSA has some important differences from the HRA. For one thing, you have the option to add your own money to the HSA account, in addition to anything that may be deposited by the plan sponsor. But the total contribution from all sources is limited to an amount defined by the IRS. The money you deposit isn't subject to taxes. Furthermore, HealthFlex HSAs can earn interest depending on investment options. HRAs don't. If you leave HealthFlex or the UMC, you take your unspent HSA balance with you. It's yours no matter what. HRAs may not be yours forever. If you leave the UMC or waive HealthFlex coverage, you have 90 days to spend any remaining HRA balance. After 90 days, your unspent HRA funds are forfeited. But if you retire from the UMC or your plan sponsor, your HRA balance remains usable until the funds are exhausted. There is also an additional account option with all plans, a flexible spending account, where you can elect to contribute additional pre-tax dollars to pay for eligible medical expenses during the year. The Health Flexible Spending Account behaves differently with HSA plans than other plans. So ask your plan sponsor for more details if you are thinking about a flexible spending account with an HSA plan. If you have eligible dependents, you can have a dependent care flexible spending account to pay for child or elder care expenses with any HealthFlex plan you choose. It works the same with all plans. The HealthFlex Exchange brochure and handouts have more details about HSAs, HRAs, and FSAs.
So the health accounts help you save money. They are tax advantage accounts to decrease how much you spend on health care. You can see from the various plans, this is again a reiteration of what we talked about earlier with regard to what the employer is contributing. Now this is part of the plan. It doesn't come as a separate bill to the conference or to the church. It is already given benefit with the plan. So those contributions or those employer contributions on the HSA, HRAs are already built into the whole package. Why consider a plan with a health account? Well, the contributions will be available to you on January 1st, and you are using employer monies for the current year expenses and save money and save for future needs. You have an option of adding more for personal contributions on the HSA. And like we've said before, well over two-thirds of the health exchange participants are enrolled in these very HRA, HSA plans. Now how the tax savings works, if you have $2,500 in out-of-pocket expenses, in this sense that for doctor's visits, tests, and medications, no matter what, your share, which is not covered by a plan, included in the HSA, HR account, is going towards the $2,500. So if you got a $3,000 deductible and you're expecting those out-of-pocket costs, this can help you say, okay, what do I need to do to lay aside to protect myself and have ownership of those monies? If you paid the money out of pocket, you would pay tax on that $2,500. But if you contribute the $2,500 to a pre-tax salary deduction to an HSA or an FSA, you don't pay tax on that. And if you were in the 22% tax bracket, you would save $550. So the tax advantages of the health accounts are restated here for you. You also notice that primarily in the HSAs, you've got quite a bit of opportunity for the participant contribution, the employer contribution. You have tax-free growth. That's another component of having an HSA. The money can grow at BYN Mellon. And upon distribution, these are tax-free distributions. All the other accounts don't compare in that same way. Now they give you this option, this slide here, just having understanding here is even your UMPIP pre-tax dollars. So how much should you contribute? That's up to you, but you could use the ALEX tool to estimate your out-of-pocket expenses. You could also talk to EY financial planners so that they can review your goals. You can try to save enough to cover 100% of the current year expenses, plus additional savings for emergencies, planned future needs, and health care expenses in retirement. Again, this is a redundancy in, as far as comparing the plans on how they work on the HSA, HRA, and FSA plans on the health accounts. Kind of gives you another snapshot comparison. This is also in the handout that you have. I believe it's on page 11. gives you another handout and gives you more details of each of the plans. So how do you decide between an HSA and an FSA? You may consider, well, I like the H plans for the HSA component, but I'm kind of interested in the FSA because I know routinely I'm going to have some out-of-pocket expenses. In looking at your FSAs, your flexible spending accounts, you want to fund that for services you absolutely know you're going to incur. If you know you're going to get eyeglasses, contacts, certain meds, you might want to fund an FSA because you would use that in the next current year. Now you could do the same with the HSA, but if you're trying to maximize tax breaks, you can layer these things. So for myself, I use the FSA because I know I'm going to buy contacts, I know I'm going to buy glasses, so I'm going to fund that. The money's there for me the very first of the year. So I can go out and buy my bifocals and get my contacts for the next 2 years. Those kind of things. Now, but I also know that the FSA money, if I don't use it by the end of the year, I lose it. And that is a very strong difference between an FSA and an HSA. Now, if I'm building money, I may choose, if I'm eligible, to use the HSA to, again, push money into a tax-saving account to offset my costs for medical care. But there's just 2 different levels in which you can do to help you shore yourself up for the coming year. So like I say, they have multiple health accounts. They have a debit card, which is with WageWorks, and the different accounts work very different. They're layered in your WageWorks card. So what happens, what pays first? An FSA, if you're enrolled in it, that's where the money would come out first. We have, if you have documented expenses of $1,300 or $2,700 for a family, the HSA can pay first for medical, RX, and behavioral health. You might have to do some paperwork with BY and Mellon, basically supporting that you've met your deductibles. So this slide is just kind of a flow through as understanding the various accounts and who pays first. A recap of the accounts, having excess accumulated to pay the bills, how they're funded, your HSA monies. If your employer monies are all put in the very first of the year. So if your plan comes with a $2,000 HSA, that goes in January 1st. Your personal contributions to an HSA go in on a monthly basis. So, it's deducted from your compensation. Westpath bills us for it. We send it up. They deposit it into your account, and that's your personal HSA monies. Your FSA monies are deposited on the first of the new year, and even though they are deducted from your compensation throughout the year. Dependent care flexible spending accounts. Now, I want to say one very strong statement of concerning dependent care. This is not for your spouse. Well, some people have gotten confused with dependent care, thinking, well, if I have an FSA for myself, dependent care says my spouse, so I'm going to do dependent care for medical. That's not the definition of dependent care for the flexible spending account. So if you thought you were funding that for $3,000 that year for your spouse's out of pocket, no, you funded that for daycare. And it is primarily, when you look at dependent care under the flexible spending, it is for services taking care of somebody. And even if you have an elderly dependent, say, mom needs to live with you, but now you're tax dependent, and your mom goes to adult care while you're working, this is another component you can use. Those are very rare circumstances, and you must make sure you know your homework, do your homework in setting up a dependent care. For those with dependent children under 12, it's been a beautiful feature over the years. So again, how to choose or why choose a HealthFlex HSA HRA plan, lower monthly premiums, tax advantages, carryover for retirement, and Basically, you're a smart consumer.
Through HealthFlex Exchange, you'll shop for a health plan like you shop for other goods and services. By comparing options, comparing pricing, comparing features. Then, select the plan or plans that best fit your needs. Consider your budget and how you would handle your share of unplanned medical expenses. Would you rather pay more for your health benefits each month, but have a closer safety net and pay less out of pocket if you have a big expense, like an emergency room visit or hospital stay? Or do you prefer to pay less each month, knowing that you may have to save some of that money to pay a higher share of costs when you use healthcare services, or if something unexpected happens? Your decision may vary based on how many people you cover and whether your premium credit increases if you cover family members. Also, remember that if you cover family members, you can contribute more to an HSA, but you also have a higher family deductible for the HSA plans. You want to think about how regularly you or your family members see doctors or take prescriptions, and you might want to factor in potential procedures your doctor may recommend. One plan is no better or worse if you need to use frequent services, but you want to think about how much premium you'll pay each month and how much you might pay for out-of-pocket expenses for each of the plans, so you can choose the one that works best for you. So yes, there's a lot to think about when choosing a plan. That's why Westpath offers you Alex, the virtual benefits counselor. Alex will walk you through your plan options and explain how your premium credit works long before you actually have to choose a plan. Use Alex to learn more about each plan and to compare different plans side by side so you can make an informed decision when making your choice. Alex can help with your dental and vision plan choices too, and also help you estimate how much to set aside in an HSA or FSA. Find Alex on the HealthFlex WebMD website. Any information you enter is confidential. You can log in 24/7 to use Alex as often as you like. Alex walks you through plan cost scenarios based on what benefits you think you'll use next year. The out-of-pocket costs shown by Alex are just estimates and not a guarantee of pricing. Westpath's recommendation is that you pick the plan that provides the best projected overall value based on your needs and is not based solely on monthly premium amount. We recommend making notes as you walk through Alex in the How Do I Choose brochure, designed to guide you in making your choice prior to annual election. If you aren't comfortable or still have questions after reading the brochure and using Alex, you can speak with a representative during annual election for help.
So how do you choose? You're going to get more details coming out by mail and during annual election period. The two primary decision tools are Alex and how you choose the brochure, which is the brochure in your packet today. I also encourage people to go to your WebMD portal, your HealthFlex WebMD portal. There is quite a few details there. Alex is already live for this year through your portal. We do not have it on our conference website yet. We will have it next week for the updated one for 2020. There's more details you can provide, and also frequently asked questions. There are various vendor links and et cetera through your portal. If you haven't visited your portal since last year, you might want to make sure you remember what your passcodes are. Okay, so kind of want to do that. You don't want to do it on November the 14th at 2 minutes till 12. So consider that. Okay, so as far as the Alex Benefits Counselor, it's been available on the Westpath website. Of course, if you've done it before, it's certainly pretty lively. It takes about 20 minutes to complete. It explains some various concepts that you probably have heard over and over again. You're getting used to these things. And it does provide you a recommendation, but it's not something you have to live with just because they recommend it. It's just using the various algorithms of what they provide through this Alex tool to help and guide you. But it's not something you have to live with if you're sitting there going, oh, I'm not feeling comfortable. It is your decision when you do your enrollment. Like I said, it will recommend a plan. It crunches the numbers. It'll do a comparison for you. It'll explain the tax savings if you're using something with an FSA, HSA contributions. Throughout the year long, you have other consumer tools, Alex, of course, resources to minimize your costs, all on your portal. I encourage if you don't use it, just and you're bored at 1:30 in the morning, go looking, because there is so much information out there. You can see your explanation of benefits through your Blue Cross Blue Shield vendor. You can check your WageWorks card. The WebMD portal is excellent as far as providing you a lot of information. We cannot give you, as a conference office, information concerning how your claims were paid. We don't have that access, but you have it at your fingertips using your portal. So more details, of course. If you need more information concerning the various plans, that's all provided in there. If you need to discuss that, then you have that ability, with that representative during open enrollment, along with also the health team is available to you. Certainly, I'm a resource in the office to help you brainstorm, considering your options if you just need to talk it out loud. This is a confidential conversation that we can have.
During annual election, you'll enroll in a HealthFlex plan online through the HealthFlex WebMD website. Log in to reach your personalized WebMD homepage. From here, you can still access Alex Benefits Counselor if you haven't already, or if you want to take another look. To make your elections, click on the annual election link to begin your elections. The preferences you selected with Alex don't automatically translate into your elections, so make sure you take this step. Once you have compared monthly premium costs, expected out-of-pocket costs, and reimbursement saving account values, make your choice. While online, you'll first see the medical and pharmacy plan options and the full cost of plan premiums and how the cost is offset by your premium credit. Once you enter the plan you choose, the price you will pay per month will be shown. Remember, your annual conference or employer will fund a fixed dollar premium credit that helps offset your cost for plan premiums. Once you select a plan, your premium credit amount from the conference or employer is applied to your plan purchase. If your premium credit doesn't cover the full cost of your plan, you'll see the extra contribution you owe, which will need to be withheld from your pay. View your dental and vision plan options and prices, then make your selections. Your premium credit can help pay for dental and vision premiums too. If you'd like to contribute to a flexible spending account or health savings account for next year, annual election is also the time to make those elections. After you pick your HealthFlex plan, you will see prompts for optional FSA elections. And if you select an HSA plan, you will also see a prompt for optional pre-tax contributions to your HSA. For the HSA election, be sure to accept the HSA terms and conditions when prompted. Approve your selections and print a copy for your records before you sign out. Review the brochure and other materials provided by your plan sponsor and WestPath if you'd like more details about HealthFlex Exchange. HealthFlex Exchange is designed to give you more plan choices, more flexibility to select the plan that fits your needs, and more control over how much you want to pay for a health plan, balanced with risk. With the broad provider networks, high-quality wellness programs, and numerous resources that have always been a part of HealthFlex.
As we mentioned, the annual election, AE, starts October the 30th and ends midnight, November the 14th. You can use Alex to help you decide what you want to do, but remember, Alex is not where you're going to make your election. You have to leave Alex and go to your annual election login to elect your plans. You'll choose the plans for 2020. Now, if you do not make any election for 2020, and even though you might be in the C2000 this year and have dental and vision buy-ups, if you make no elections for 2020, you will be provided the given plan, the H2000 with no buy-ups. So you have to make elections other than you're going to go back to the given plan. It's very important that we routinely, it's like doing your taxes, you have a deadline. And so this is a deadline for your open enrollment, annual enrollment, and make sure you can do that. And also I highly encourage you to make sure you print your final sheet, because you have to do a couple steps at the very end of your enrollment or your election thing to confirm that you approve and confirm what you elected. Make sure that if you're doing an HSA, that you agree to the terms. You must agree to the terms, otherwise they'll bypass you even if you said you're going to put money in. You have to agree to terms. Like I said here, you're going to review, approve, and confirm. There's a couple steps at the end. It's very important that you finalize that when you do your election. There's also some telephone support beginning in late October. There are representatives at this telephone number. It's the same group that's been available in the last couple years. They are from 7 a.m., 7 p.m. on Central Time if you need additional support in working with the election. So if you're online and you can't figure it out and things are causing a problem, then you can call this particular telephone number. They are the support group for the election period only. Now here's just a timeline of things that are going on. Certainly you've received the first mailings here in August or mid-September concerning election period is coming. The Alex tool is already out there on the WestPath portal. We will have it here on the East Ohio website probably by Friday or Monday. So October, you're going to do the communications will be coming. You've got open elections by the end of, that start October 30th. We end in November. You made an election. You can always revisit Alex at any point. There'll be quite a bit of information passed to you in December, along with notices to your employers as to any buy-ups or elections for contributions, such as an FSA, HSA. And then January 1st, 2020, we go live with your new benefits. So now we're going to have a little bit of an overview of your well-being. And there are basically 5 components to the well-being program through WestPath. Your health matters. The 5 components are physical, emotional, spiritual, financial, and social. Why well-being? Well, because it's important. It's important to your family. It's important to the church. We want to provide energy and vitality for the family, friends, community, and ministry. We all want to be able to do things we want to the best possible way, keeping active, managing stress, eating healthy, and taking time for you. So these are all components through the well-being program. You've probably gotten inundated with either emails or prompters through various programs. What are you doing for yourself? You can also earn extra money. You and your spouse, if they're covered by HealthFlex, can have the ability to earn up to $410 per year. It's $100 for completing the Blueprint for Wellness screening, and then up to $160 by participating in the Virgin Pulse Wellbeing Program. And you can earn $150 in the Wellbeing Points. These points can be earned in engaging in various programs, even if it's accessing your benefits access or working with EY Financial, Nutri Savings, MD Live. If you even improve your Blueprint for Wellness numbers, you can earn these extra bucks. So most of them all can be fun. And certainly enjoying setting up your Virgin Pulse challenges with friends and colleagues. If you're involved in the Virgin Pulse, you can see that those are prompting you to any challenges across the denomination. Here's just another slide outlining those various programs for well-being. HealthFlex WebMD website lists those. Those are your hub for all the vendors. Virgin Pulse can be linked through there. There's also a diabetes prevention program. I'm not certain how many people have engaged in that this year. OMADA. That's been pretty much out there since about the 1st of June. And it's certainly, I'm anxious to hear what WestPath says in a couple weeks as far as participation and how that coaching product has worked. And then, so that health coaching is another piece with WebMD, is phone calls. If you accept that opportunity and work with you, whether it's stress or preventing diabetes, those are things that you can use as health coaching. EY Financial Services, you can use the web and the phone, and using that to help you pre-plan has a lot of things to do with your future, but also they can help address the concerns on your HSA's opportunities. There's also attached to the plan is another called Employee Assistance Program, is the EAP. This is counseling. It's related to work, or whether it's related to work or relationships, family life, relocation. There are 8 EAP programs that are provided at no cost to you. Now, something different that's coming for 2020 is that this particular program is going to be now part of Blue Cross Blue Shield and not a separate plan. So these 8 programs have been through United Health, Behavioral Health, and they've been outside of Blue Cross Blue Shield. And so based on a conference that Robin and I sat in yesterday, we just found out they are partnered with Blue Cross Blue Shield, and you still get the same benefit, but it all go through Blue Cross Blue Shield. It won't be as clumsy as it is today for this particular assistance. There's also, through the EAP program, you have some work-life services, anything from helping to find local resources for child care, elder care, legal matters, the WebMD we talked about, and also Weight Watchers. Weight Watchers out there, and they will subsidize 50% of the membership. Resources for you, your family, and also for your congregation. You probably got inundated with a bunch of stuff for webinars. There's also toolkits that they offer, quarterly newsletters and bulletins, and also you can go through your portal and look at Dexercise and, stretch break videos. So, I'm sure that we all want to do that when we stand up at our desk. And so there's also things that you can download for your congregation if you want to use on the newsletters. So they offer an awful lot of resources that are available for you, your family, and your congregation. Pretty much your decision support summary through the conference is going to be using off our web page, our website. You'll tab over to the Finance and Benefits tab and then drop down to Health Benefits. That page is pretty much loaded with everything you need to know going forward. It will have this presentation along with Alex access, along with all the various pieces that we presented today.